So, hi, welcome. Thank you for joining us.
Thank you for having me.
Would you like to introduce yourself?
Sure. My name is Sydney Shackelford, and I'm a resident of Bergen County for over 20 years.
Awesome. And how does the LGBT community relate to you?
Well, first, well, I'm like several acronyms. So basically, which is a lot. So basically, I'm a transgender woman. Let me rephrase that. I'm a woman with a transgender history. I'm also a lesbian. My wife and I have been together for 24 years, actually 25 years. Um, Long-term committed relationship, and we, enjoy the community, the county in general, and we found friends, and we have a hard time finding people that are like us. We both have straight friends and gay friends and trans friends and cis friends and everything. And it's nice to be able to talk with someone to have that commonality. Um, that's something that we do help out with PFLAG, and we do help out with different groups, um, and kind of form something. But I guess the community kind of calls us in a lot of ways. It's a good way to describe it.
Yeah. Yeah, you're one of the leaders in Bergen County.
Yeah.
And I mean, and that's not just coming from me. It's you're one of the people, the go-to people in our county. So you're very needed, very much a part of the community.
Mhm.
So the question I'm gonna ask you is, why do you think we don't have an LGBT center in Bergen County? Do you think it's needed? And what would be those needs for you specifically?
I think one of the reasons we don't have one is our proximity to New York. And I think that's one of the main reasons some people, but the thing is that we have so many people who are LGBT in this county, and they don't want to go into the city, or even Jersey City, where it's a Pride Center. I think that's the closest one to here is in Jersey City, and Bergen County is unique. It's not Jersey City. Worked there for many years in that town, but it's a very different feeling. Um, and I think one of the other reasons is, you know, areas like New Brunswick's more of a college town. You got Rutgers and so forth, and you don't have that here in Bergen County. I think that's one of the reasons why, our, you know, politicians or local politicians have been very supportive, but I don't think they understand the needs of the community for resources. And they just assume that our proximity to Manhattan is enough, and it really is not enough. I think it's really what it comes down to.
Yeah. Yeah, and it's also people, a lot of people are talking about, well, you can go to New York City,
Mhm.
but you can't go to New York City. You're not a resident of New York City.
Exactly.
And and I've heard that where politicians are like, well, you can go to New York. I was like, you can't unless you have, paying completely out of the pocket, because that's what it would cost, and then paying New York prices on top of that.
Right.
You really can't go to New York City. You can't ask, for services. You're not a resident there.
Right. You miss out a lot of programs, and even your insurance isn't taken there.
Yeah.
Unless you go to special circumstances, or you happen to have a family member, or a relative, parent, or a spouse who happens to work in the city, then that's different. But not everyone does. Most people don't.
Yeah.
Uh, so that is a very good point. And I was on the board advisory panel for Cal and Lord, and we had several from New Jersey, quite a few. It was I think it was around 15% we had patients from Bergen County, and because of the problem with insurance, it was a good chunk that would pay out of pocket. So that was definitely a problem.
And there still are people paying out of pocket
Oh yeah,
still.
absolutely.
And,
Yeah.
and, and, and it's not like you have a roadmap for people, that, you know, it's not like transgender people are born into transgender communities with transgender families and they're taught how to do this. And there's
Right.
no like, you know, and it's not like you can just walk down, if that's not the case, walk down to the local transgender store and then like, how do I go doing this? It's everyone has to figure it out themselves. And
Right.
unfortunately, you know, people don't know those little tricks, or, you know, they just, I'm just gonna pay out of pocket. And I know of a couple of people, and they are working like 5 jobs nonstop, you
Mhm.
know, so they can do this. And it's just sad, you know.
It really is that. And I mean, there have been other resources in New Jersey, in Somerville, New Jersey. There's the Robert Wood Johnson Proud Family Health down there. But it's Somerville, it's Somerset County. I mean, it's 2 counties away, you know, an hour drive nearly. So that's not exactly close. You know, Manhattan's actually physically closer, but well, with traffic, the bridge and tunnel, that can be almost the same amount of driving time. But you know, if you, it's still, it's not a local resource. Um, and that's something that's needed. And even once you transition, just finding doctors who are educated in transgender health. Just for example, my primary care physician, finding one locally is, yeah, because you still need a local physician for other issues of health insurance. Because being trans is just a small percentage, small part of your health and issues. Um, and that you have to deal with, you know, medications and that type of thing. Um, you know, it's, you have to find the right one, and that can be difficult at times. Finding, there's no directory that says, "Hey, this doctor's okay," that knows, and you know, because the rules are a little different. Medically speaking, when someone who's transitioned, depends on how far transition they have. They may have, you know, certain symptoms or reactions to medication. It may be more one you know, male or female, depending on where they are in the
Mhm.
transition. So, you know, those factors make a huge difference.
You know, and that's really I don't think people understand or hear what you're saying when you talk about that specific
Mhm.
issue. And it's funny because, you know, our parents are of that age where they walk around with suitcases of pills. You know what I mean? And it's like, you know, and it's like going to a doctor is a serious thing. It's like
Yeah,
they need to know the right doctor because that understands their particular needs and their illnesses. That's a very understood concept for many people from, I think, from maybe even younger than our generation and up. You understand you need to find that right doctor for
yeah,
you. And then if you belong to certain communities, you want to find those doctors. You know, if you're a person of color, you may
mhm,
want to have a doctor that is a person of color because there's issues in there, right? But yeah, when people that are transgender and they're saying, you know, you need to find the right doctor, like, well, why can't you just go to any doctor? You know, it's like,
yeah,
why can't you? And it's like there's real reasons that you're stating, the complications and, you know, with all the different you know, depending on where you are in your therapy or your health, you
mhm,
know, and you know, so there's real reasons for this, but still people don't hear that, and their response is like, oh, just go to any doctor.
yeah. It's very different. You know, a perfect example would be if someone has a heart attack. Well, men and women have very different symptoms, and you know, a transgender woman, for example, well, if they're in the beginning of the transitions, their symptoms might be more on the male side. If they've been on hormone therapy for years and you know, transition because of estrogen and different things, and it's going to be more of a female response. So it just really depends, you know. Yeah, and not all doctors know this. And some doctors are like, well, I don't know, you know. And there's also doctors like, well, if you go in for a broken leg, they're like, well, it's a leg. It doesn't matter if it's male or female. And that's not really the right answer. I've heard that answer before, but it's
Yeah,
not really the right answer because you know there's different side effects of medication, different things, and pain, and there are some differences.
yeah.
Um, and you know, some of it's hormonal, some of it there's different things.
Yeah. And I just wanted to highlight that. And yeah, everyone has valid reasons as to you should be able to choose which doctors you feel comfortable with
Mhm.
and having those experience. But it goes deeper. And I don't think people realize that it goes deeper and
It
that there
does.
are physical differences. And I just wanted to make sure, people hear that.
Yeah.
Um, so do you think that it's needed to have an LGBT center?
Well, absolutely. I mean, for community and people to exchange resources, doctors they recommend or places to go and different things. It's important that people understand and to get you basically, and to have a doctor or someone who gets you and understands. It doesn't mean they have to be LGBT. They may have a family member who's LGBT. They have a better understanding of it. Because I can't tell you how many times I've had to educate doctors on things. And sadly, the amount of time they spend on it during medical school is very, very small when dealing with trans. Um, it's getting better every year, but still it's quite a bit. And I've actually have presented at different lectures at Rutgers to explain different things, and it amazes me. The newer doctors are very eager to learn. But some of the old doctors are not. But there've been a few surprises. There've been a few. But
Mhm.
even beside trans issues, just LGB portion as well. I mean, my wife has gone in to see a doctor, and I've actually been asked, like, "Well, who are you? What are you doing here?" I'm like, "I'm her wife," and they're like they're shocked or something. And
Mhm.
it's like, it's like in this day and age, you think that would be more like, oh, okay, no big deal. But we've had a
Yeah.
few that were kind of taken back by it, or their attitude had changed, and nothing horrible, but something changed, and you can
Yeah.
definitely, yeah,
And
you
then
might have experienced that yourself.
yeah, and I can tell you number of times, and
Mhm.
and the thing is, it's like we're just hearing about this where you know with the Black community how um doctors do not, well, let me say there's a number of doctors that don't listen to the needs of Black people when they go to get treatments and stuff. Like they downplay their
Mhm.
stuff, and I think that's across the board with a lot of people, ethnicities, um, and it's so you don't want to be in having someone that's taking care of your needs and is looking at you with a funny face. you know
Yeah.
it's like here's a quick story. So I went to I had COVID and I went to get my test done.
Mhm.
And so it was me, my husband went separately with my daughter and my best friend, and we all went on the same day. We all went to the same place, but at different times, and the experiences between us was so differently,
Mhm.
you know. And I'm a person of color, but I can pass as a white person very easily, you know. I have light privilege. I'm very light skinned, and if I dress a certain way, I look a certain way. But when I went there, I had COVID, and my husband clearly had COVID,
Mhm.
and all they wanted to do was, you know, um, take the test. Okay, you have it. Goodbye, and come back, and you can end your quarantine in a few weeks. My husband's experience was, oh, let's take your heart. Let's check your this. Let's check this, and let's check all this stuff. It's like the
Wow.
same doctor and completely different experiences. But then I'm like, it's busy. Everyone's COVID, maybe they were just tired
Mhm.
with me. I go back because I was on medicines that was affecting me negatively, and I thought it was just COVID the whole time, but it wasn't. My doctor said go either to the ER or go to one of those med things just to check to make sure this is not happening. If it is, then you have to go to the ER. I go there, and the doctor, that's the same doctor, he's like, no, I don't think you have that. I'm like, I just met you. You know what I mean? You know, my doctor's telling me to do this. Look, you here's the email. And he's like, no, no, I don't think it is. And it was giving me such a hard time about this. And I was like, okay, well, could you just not talk and just do the test?
Yeah.
Does the test, and he turns around and says, no, it's nothing. To find out it was exactly what the doctor was worried about. And I was supposed to go to an ER, and he just blew it away. And they logged in the test as, it was positive.
Mhm.
And I was like,
Wow.
you know, so yeah, those things are real. You want to piss off your doctor.
Yeah.
Um, so do you have any other things you want to bring up? This is like your platform.
Well, I think I'd like to see, a little more involvement of the county and politicians and being there. I mean, it's great to have the visibility to the flag raising, and those are wonderful things. But I would love to see, especially if, they don't have to be, I understand if a yeah, local politician is not LGBT, but I'm sure a lot of them have family who are. Uh, I mean, I'm sure. And just sharing stories and and acceptance, and those are good things to hear about and see. And I think that goes a long way in helping community and understanding. Um, and it's not just for people like me who, people don't know I'm trans unless I tell them they knew me before. And I think it's important for people who maybe don't fit into the binary, especially, to feel comfortable because they may not. And I think it's important for them to be able to feel comfortable. And I think having a center would be a wonderful thing, especially for people who are young, who may not have supportive parents or supportive family. Um, I'm lucky that, I have a wonderful wife, and my family's been, very accepting for the most part. At least my local family here is a family in Georgia who is not. Um, but and parts of Tennessee. But for the most part, most of my family has been very, very good. But not everyone has that. They're not fortunate to have that. And a center would kind of give a refuge. And I know of people who are trans in Bergen County who don't have supportive family. They can't be their true self around their family, and they need an outlet. And I think and someone to talk to, and feel good about who they are until they're able to get on their own and do their thing and be them.
Yeah, absolutely. Yeah. And it's really important to have space. And I try to bring that up to people. You know, we're a community here, but unlike all the other communities, they have churches and spaces
Mhm.
for them and families. We don't have any of those things. And a safe space can mean the difference of life and death for some people.
Oh, absolutely.
And there are a lot, I've witnessed that myself
Yeah.
a number of times. And it's needed. It's needed.
I mean, and there are organizations like PFLAG. I do co-facilitate for PFLAG, and we get a lot of parents, wonderful parents, and I applaud them when they come in. I really do, because they're there as an advocate for their child. Um, whether they're in high school or in college or some even older, they might transition later. The parents are there to get support and to talk to other parents who are going to kind of go into the same thing. And I kind of there as a moderator and kind of, and a lot of times I get questions too. It's like, well, my child does this. Do you have any idea why you've been through this? And resources, and that's really wonderful. Um, but PFLAG is not, it's a meeting once a month, support group. And although we do have trans individuals who do come and we separate to a separate meeting and separate from the parents and family, it's still not, it's only available to those whose family parents are supportive. And even then, it's not the same thing as having a separate support group. And a lot of times, a lot of them are uncomfortable to talk around, or sometimes their children may not want to come because they're afraid of, the parents are going to talk about them. They don't want to be, even if it's in a separate room, they can't hear. They just know it. They don't want to be that close to it. Kids are kids. But it's, to have that community for them, I think is also important. Another Pride Center in Highland Park, New Jersey has been very successful. I would like to see us have something like that here in Bergen County. I do know people who are there, and I've actually, when I first started my journey over 7 years ago on my transition, that's where I went. There was also the city, but I actually chose to go down all the way down to Highland Park. Once a month for a support group meeting, and that was a choice. Not everyone can do that, especially younger, and transportation is not easy when you're younger.
Yeah, exactly. I mean, like the theory, you can just go somewhere else out of town. How do you do that if you're 16 or 14 and you don't have transportation?
Right,
How do
exactly.
you do, yeah, how do you do if you're on a fixed income and you're older, or you're you don't have the ability to jump on bus and train and subway and all this kind of stuff.
Yeah.
So it's, and besides all of that, why are we paying taxes if we live in this county and we don't have service? The response is go to another state or another county to get your
Right.
services. That's just my 2 cents.
Um,
So let me ask you, you're aware that this is being recorded
hmm,
and that this is to be made public on a web page, and do you give consent to that?
yes, I do. Yes.
Yes. And do you feel comfortable with everything that was talked about here?
Yeah, I feel pretty comfortable with it. I hope I didn't say anything wrong.
No, 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 absolutely. I thought I should have kept my mouth shut a lot more and just let you talk, but
There's nothing I would have said to anyone else. And, I do love this area, and the county's been great. I will happily say I've never really experienced anything bad. Nothing's bad happened to me here. No homophobia or transphobia I've experienced personally. But I know people who have. Uh, but it can happen anywhere, of course. It happened in Manhattan. I know people what's happened to in Manhattan.
Mhm.
But I think having that support system helps when something does happen. That's something to fall back onto. And also, once the pandemic is over with, I think people will be wanting to meet in person too. I think that's the other thing too. I mean, Zoom is great, but it's not the same. And we're getting through this and getting vaccinated and everything. So I think that's gonna the timing will be wonderful if we get this started right after the pandemic.
Yeah. And I just wanted to say before we wrapped up that how lucky we are to have you as one of our leaders. Um,
Oh,
no, but honestly, I mean, you could go stealth very easily and live your life and just, fine. But you chose not to do that, and you do help so many people with PFLAG and doing all the work you do. And I mean, without people like you, we wouldn't have a community. We just wouldn't have anything. And it's so valuable to see your strength and your beauty and your ability to give back. And it's just so, I don't think people in your position hear enough of gratitude for what you do. So I just want to say thank you so much on behalf of all of us. Thank you for being there, because you're so needed and so valuable to us.
well, thank you, and really for you for help organize all this. I mean, you're one of the leaders too, so thank you.
Well, this is just a long rant of mine, this whole project. All right, so I'm gonna end the recording if you want to say goodbye to everyone.
Okay, well, thank you everyone for listening, and I hope something really wonderful happens from all this. I really do.
I
Thank
hope so too.
you. Yeah.